Yeah, I still see it. That's fine. Should probably sit the other way though. Over to you. Okay. This is recording right now?
Yes. It should automatically record. Okay, everyone, good afternoon. This is Adam Sotok, the Public Engagement Director with NC Child, and I want to thank you for joining us for this first of 3 webinars as part of our Fall Lunch and Learn series. And this is the webinar today, and the other 2 are going to be focused on the topic of family economic security. And today, Whitney Tucker, our research director here with NC Child, is going to be reviewing some basics and going over some background on the scope of the problem of poverty here in North Carolina, specifically child poverty, and how that, and some of the reasons why we feel like it's so important at NC Child, along with many of you, to advocate strongly for better economic policies for our children and families across the state of North Carolina. We know that some of the effects of living in poverty can be devastating, and if we can do things to help families be more economically secure from a policy standpoint, we want to be involved in those solutions and try to help make that happen. So as I mentioned, we're going to do this webinar series where we're trying to give you short snippets of information. So we'll just be going till about 12:30 today. After I open the webinar, Whitney's going to do her presentation, and there will be an opportunity at the end for questions and answers. So somewhere there in your toolbar, there's a Q&A box that you can click on. You can click on that Q&A button, and if you type something into the Q&A, then we should be able to see that and hopefully get an answer to your questions. This webinar is being recorded. All 3 of them will be recorded, and we'll be sharing out a recording of it after the webinar is over to all the participants and those who registered. I do want to say that as we go through this series this fall, we're really hoping that this is going to lead towards greater action, that we at NC Child and all of you as part of the Child Advocacy Network across the state of North Carolina are taking to try to advocate in a proactive way for some important family economic security policies here in our state as we move forward into 2020 and beyond. But for now, I just would like to go ahead and turn it over to our wonderful research director, Whitney Tucker, who is going to share more.
Perfect. Thank you, Adam, and thank you everyone for joining us today. As you said, I'm just going to go through pretty quickly the short general state of what poverty is looking like for children in our state right now, and then also some of the disparities that we see and some of the impacts that that can have on children throughout their life course. In later Lunch and Learns in this series, we're going to talk more deeply about economic mobility, what that means, and why families in North Carolina are struggling, and then also talk more about some policy solutions that we at NC Child think could be really helpful for families. But jumping right in, for those who may not be familiar, NC Child is a nonprofit, nonpartisan public policy advocacy organization. We are based in Raleigh, but we work statewide to really build a stronger North Carolina by advancing public policies that ensure that all children, regardless of their race, ethnicity, or place of birth, have the opportunity to achieve their full potential. We work across a number of different issue areas that you see on your screens, but we really feel that it's important to not just focus on one single area of a child's life, because so much of what makes children and families strong is a combination of factors, right? And so if we want to have public policies that are going to support kids and support their families, we need to look outside of just, for example, education, outside of just health, outside of just economic security. In strategic communications, direct advocacy and lobbying, and then community engagement work, which is where most of you probably know Adam from. So getting directly into the issue of child poverty, what we know right now is that children's well-being is really dependent on the well-being of their families and their communities. Growing up in poverty increases the likelihood that a child will be exposed to factors that can harm their brain development and make success in school and life harder to achieve. Children living in financially secure families have been found already to be more likely to succeed in school, to stay healthy, and to become economically self-sufficient as adults. All of the points that you see right now have been proven in multiple studies, and the fact sheet that we'll be sending out to accompany today's slides includes references if you'd like to read up some more on source material on these outcomes. So when we say living in poverty, I want to be really clear about what that means. The federal poverty line is what is used to determine whether a child or a family is living in the circumstance of poverty. The federal poverty line uses basic food costs from 1962 to estimate by income level for families of various sizes how much they should need to cover what was considered basic needs at that time, which is, again, the cost of food in the 60s. That same standard from the 60s is in use today, and then it's updated for price changes using the consumer price index as that grows. We all know, however, with our own families, that the costs of raising a family obviously are a lot larger than just the price of food. Now we have prices that are really getting out of control with things like childcare, transportation. All of those are not included in this measure of poverty. And so research really suggests that most families now need an income that's approximately twice the federal poverty line to meet their basic needs. And I actually included a short bit of the chart that the federal government uses to determine that poverty line. Based on the 2019 numbers, these are the amounts that a household would make and the number of people in that household to be considered poor or living in poverty or living under the poverty line. So for a family of four, we see that it's just over $25,000, which is incredibly low. So advocates for family supporting policy now really often use the term low income to refer to families whose income meets that threshold of twice the federal poverty level or federal poverty line, so 200%. So that would be about $50,000 for a family of four in 2019. And so while those families are not considered by the government to be living in poverty, they are often struggling to make ends meet. And as of 2017, 43% of children overall statewide live in poor or low-income homes. It's about 986,000 kids. And so while that is really unacceptable, the data actually tells a much more policy-focused story when we disaggregate it by race. So again, as a reminder, we're looking at 43% of children overall statewide living in poor or low-income homes, but only 29% of white children, 34% of Asian and Pacific Islander children, 60% of Black children, and 69% of Hispanic or Latinx children. So historic barriers to family financial security and economic mobility still persist today, and those barriers have resulted in child poverty rates that give us disproportionately negative outcomes for Black and Latino children. Despite making up only 41% of the child population, Black and Latinx children account for 57% of children in poor or low-income homes in North Carolina. So for comparison, non-Hispanic white children account for 54% of the state's total child population, but 34% of children in poor or low-income homes.
Just one quick thing I would add to that, Whitney, is in doing presentations to local communities throughout the state, it's not unusual that sometimes when we're just looking at a city or a certain county that we'll see these numbers are even higher,
Yes.
Especially, along with the different disparities, and can be really troubling.
Absolutely. So not only is race really relevant, but age and geography also factor in. Young children are more likely than older children to live below the poverty line. And research really suggests that in most places, this is largely due to young children more often being born to young parents who are less financially established than older parents. Of course, that also has a racial component in North Carolina, as the majority of our young families, or a growing majority of our young families, are Hispanic or Latinx families. And those families are predominantly younger in our state, right? And so we're seeing that a growing share of our children under 5 are actually Latinx children now. In 2016, nearly 1 in 4 children 0 to 5 lived in poverty, compared to 1 in 5 older children in the state. Rural areas are also really important when we're talking about poverty in our state, because families in rural counties are more likely than those in urban counties to live in poverty. Higher paying, more highly skilled jobs are often concentrated in urban centers compared to the availability of work in rural areas across the state. And so we see that in 2014, the 20 highest poverty rates in the state were all in rural counties in North Carolina. Research shows that children living in poverty are more likely than their peers to be exposed to events that can harm healthy brain development and limit opportunities across the course of a child's life. Childhood poverty has been linked to reduced success in school, more exposure to violence, so that's both within and outside the home. So neighborhood violence like gang activity or just unsafe streets, places where you don't have an opportunity to play outside, and then also things like intimate partner violence that children might witness in their homes. Hunger, involvement with the justice system, I say here for parents and youth. Many studies show that children living in poverty are much more likely to have parents who are incarcerated, but also that growing up in poverty increases the likelihood that a child will be involved with the justice system, either incarcerated or charged with a crime by the time that they become an adult. Abuse and neglect, and then also reduced earnings as an adult. And we're going to go into that reduced earnings point a little bit more in the next webinar where we talk about economic mobility. But essentially, many studies are showing that children who start off in families that are in poverty have a much harder time reaching an income level that is beyond that of their parents as adults, and that they have significant barriers to reaching an income that can actually sustain a family of their own. These outcomes are all more likely when a child or their family doesn't have protective factors like strong social connections, the resilience of a caregiver, and concrete supports like cash benefits and subsidized services when they really need those. And without those influences, the effects of poverty are particularly salient for young children who still have really developing brains, and those effects have been shown to really be able to last a lifetime. So I'm leaving you all with this quote, just that children are 1/3 of our population and all of our future. This is from a report from the U.S. Select Panel for the Promotion of Child Health back in 1981. And I think it is, it's still true today. And it's important when we're talking about these issues to understand that what we do for our children is what we do for all of us. And so it's not enough to just know that many children in the state are living in poverty and to know that there are these significant disparities by race, by age, by geography, and to not expect more from our elected leaders and from ourselves to really build a society that nourishes and nurtures children and their families. So do we have any questions?
Thank you so much, Whitney. Let me check the question and answer box here. If you'd like to go ahead and type a question in, then we will we should be able to see that and answer your question. Or if you just have a comment based on some of the information that Whitney shared, we'd like to hear that as well. Give that just a minute.
Yes, we see the question, will this PowerPoint be available for later viewing? And yes, it will. We'll be sending out the slides as a PDF and then also that one-pager that goes over these same points as a fact sheet that you could share with others if you're interested in doing that. Do we have any other questions?
While we're waiting to see, I think that another reason why we're really trying to raise the visibility of this issue, poverty and child poverty, even more in the state of North Carolina, is that there are many proactive and positive solutions that we could be implementing, and we're not going to be getting into those today. That's going to come down the line in our other webinars. But what we're really talking about with this a lot of times is raising awareness and educating people around us in our own communities about the extent of the problem and what are the real effects that poverty have on children and families. And a lot of times people just not understanding how vast the problem is. And so we're seeing this as an educational process that moves towards an advocacy process. I think one thing that we also get frustrated by a lot of times is when elections are happening and politicians and others are talking about what they want to happen, we're not hearing enough about what are you going to do for the children? What are you going to do to help families get out of poverty? And we really want to raise that and see that be a part of the agenda and the conversation moving forward. We have a couple other questions that have just come in. One is, are you all seeing North Carolina trends cited nationally regarding the chilling effect that the new Department of Homeland Security final rule for public charge evaluations are having on immigrant children and their access to public assistance program benefits?
Sure. So when you say if we're seeing North Carolina trends cited nationally, I'm assuming maybe you mean it the other way around, so please write in and correct me if I am misunderstanding, but that these national trends, are we seeing that show up in North Carolina? And yes, we've really been working with partners at the North Carolina Justice Center on this issue, and what we're seeing is that there has been a slight decline in immigrant families who are signing up and hoping to receive public benefits for various different programs that support families with children because they are worried about the impact on their applications for green cards and permanent residency. That is actually a really important point to bring up. A lot of the information that I presented today, we don't have that data yet for immigrant families by citizenship status or even immigrant families overall versus for citizens in the data that is provided by the Census Bureau. And so it's difficult to really parse out how big this problem is within immigrant communities. But if national data is any indicator, then we are seeing also higher poverty rates among immigrant families for a number of different reasons, partially because they are not able to get those concrete supports in a lot of the case through cash benefits or subsidy programs that I mentioned, partly because of things like a chilling effect of a public charge rule, but then also because immigrant families are more likely to move often, also because immigrant families are also in our state more likely to be younger families, and so they're having some of the same issues of poverty that I talked about when we went through the issue of children under age 5 being more likely to live in poverty, and all of that is really creating a perfect storm for immigrant families, particularly recent immigrants in our state in terms of poverty and access to services.
Yeah, and I would encourage everyone too, if you have time, go on our website and you can read a blog that I wrote that was posted last week that talks specifically about this chilling effect and the public charge change in the public charge rule. If for those of you on the call that aren't familiar with that that rule change, it's a rather complicated change in the way the Department of Homeland Security is looking at immigration status. But if you read my blog post, it'll talk about that. And while the truth is that the actual effect of who that's going to affect in the day-to-day, technically or legally, is rather small, what we're really looking at is at this larger chilling effect and really this kind of wealth barrier for low-income folks who want to immigrate into the U.S. and how the effect that's going to have. So the answer is yes, we are seeing that chilling effect. I was at a meeting and someone who's involved with community health centers said, we're really seeing an uptick in people in the Latino community, parents that are asking, how do I get my child off of Medicaid or off of NC Health Choice? These are children who are legally, of course, able to be on those programs. And so those are the kinds of chilling effects that we're starting to see and we certainly want to avoid. So we have another question here.
Sure. So we see the question, do you have the stats you shared by county as well as by state? So I'll say that it depends on which stats. If we're just talking about poverty by race, we do have those, and those are available on the North Carolina page of the Kids Count Data Center. You can get to that by visiting datacenter.kidscount.org/NC. And you'll see a number of different indicators that are available at the state and county levels. And you can choose, some of them are even available at the school district level, but we'll send out that link with the other materials from this webinar so that you can visit the data center and really poke around. But also, if you have a more specific question that you're trying to answer in relation to the data about kids in poverty, I'd be happy to try and help you get to the bottom of it. And my email address is Whitney, WHITNEY, @ncchild.org. And let's see, we have another question. Do you think poverty is growing due to many children being raised by grandparents due to the opioid problem? So this one is a little more complicated. I don't have any data to point to that as necessarily the case. We do, however, have data that shows that a number of children are entering the foster care system as a result of the opioid crisis. And that, we know, does contribute to kids' financial security in the long term because, although a lot of services are provided for children in the foster care system when they age out, a lot of the time they don't have the support system that kids in a more traditional family setting might have had throughout their lives. And so that might be relevant. But as far as specifically due to growing to being raised by grandparents, I can't really say that that is the case. Although we do know that obviously raising children, especially young children, is a financial burden on grandparents. And if they are not registered as, kinship foster care parents, they don't receive benefits to help and raise those kids. And so that is definitely a financial strain and is likely to have a bigger impact in the future if the opioid crisis continues on at current levels. Do we think that the new uses of Title IV funding for support services for biological parents under the Family First Act, even though implementation is delayed in North Carolina, will help children in poverty with family preservation and possibly avert foster care placements? So that's actually really related to the earlier question. But Adam, you can speak for you. I do think that that the new uses for the funding for support services may help families to really avert foster care placements, but I'm not sure what it will do for family financial security necessarily. I think that it's very likely to help keep families together, but without connection to other services within their communities, and also just community support. I think that it's difficult for families in a bad financial situation to really climb out of that outside of any other factors that might be acting on that family's sort of struggles to really keep their children and keep their family together. A lot of the time, it's not just money that is really at the root of those issues.
Yeah, and I think it all depends on what are the support services that we're talking about that are going to be utilized as part of this, and what are the availability of those support services. For example, when we know that 40% of the kids or so that are coming into the foster care system are coming in because of substance use disorder, problems with their parents, and that's a big aspect of it. If there aren't the rehabilitation and family reunification services that are really there to help support that family leading up to the crisis point, then it's hard to avert those placements. And that's not only a federal issue, but a state issue. We've been saying for years now that North Carolina needs to close the Medicaid coverage gap, for example, because we know there are a lot of low-income parents and families who are struggling with addiction, struggling with some of these issues, and are uninsured and more or less have very limited options on where to turn to get help before family situations become a crisis. So it's complicated, and we're hoping that obviously these federal changes help alleviate some of the problems, but a lot of these things we need to be looking at and taking care of on the state level as well.
Right. We got a request for the web addresses again, and just as a reminder, Adam's going to send out the data center address as well as my email address for those who need it. But if you just want to take a look right now, it's datacenter.kidscount.org/NC, and my email address is whitney@ncchild.org. We did have a follow-up note about the foster care and grandparents. In Stokes County, it seems that a lot of children do go to foster care, and they usually go to grandparents as a result of the opioid crisis. And so I think that, the points that we were making still stand there, especially if kids are going to grandparents, that is putting a financial strain on grandparents who are often on fixed incomes.
Yeah.
But again, we can't necessarily say that it's raising the poverty rates just yet. But I think that if the crisis continues, we'll actually have more data to really point to and see a trend there. We have another question that says, do we anticipate that the increases in education loan debts for more recent college grads are going to increase poverty rates? That is interesting. I think, so I think that what student loan debt does is decrease wealth, but it doesn't necessarily decrease income. And right now we are measuring poverty based on family income in our state. I think that in areas where income is already really constrained, so in those rural areas where folks are likely to be earning lower wages, in particular types of work, where we know that people often get really low wages, things like even, really well-respected work, like teachers, for example, that, if you don't have an income that really supports those, then yes, I think that we'll see that the poverty rates are going to go up for those particular professions. But I think that in other professions where, in areas where people are more likely to have higher incomes, the incomes are just going to keep rising, similarly to what we see in a lot of coastal areas. Honestly, the incomes will essentially inflate as the student loan debt does. And so we're not going to see the poverty rate necessarily increase really dramatically, but we are going to see family wealth drop significantly because there's just going to be such a really high debt to income ratio. And type in and let me know if that makes sense. But essentially, I think it's the student loan debt is a particularly interesting pickle because it really masks how big of a problem it is because of the way that we are currently measuring poverty. Adam, do you have anything?
No, I think that's well said.
Yeah.
Then we got a yes to Medicaid expansion, and saying that there was a recent announcement about $58 million that's coming through the state for state opioid response grants, which is, certainly welcome and good. And I will say that, there has been a more robust response in North Carolina over the past couple years. And in some encouraging ways, that's been rather bipartisan, which is great. And we don't see enough bipartisanship in coming up with some of these solutions, as you all know. And so it has certainly gotten the attention of our elected officials and appointed officials. And, there's meeting after meeting about what are we going to do and how are we going to do it. But the fact that there's actually some real money and resources coming behind it now gives us some hope that we're moving in the right direction. And I believe that our overdose rates maybe have dropped, or something has dropped recently in North Carolina, and that's at least a good sign that things are moving in the right direction. I will again say, though, the broken record that I am, that without closing the health insurance coverage gap, we essentially are fighting this opioid epidemic with one arm behind our back. So that's a huge factor that we need to address.
I think we have one more question, and it says, is it included in measured cost of living? And I'm assuming that this is student loan debt, like education loan debt, included in a cost of living measurements, and not in any that I've seen, which I think is actually interesting and something that may change in the future as the student loan crisis really gets bigger with time in our country and in the state. But I have not seen any cost of living measurements that actually calculate in student loan debt, because again, it is so variable, I think, too, based on what it is that a person studied and where they, ended up living and all of that. And so I think that in some areas, people are trying to, like individual companies are trying to take that into account when they give cost of living raises to employees. But overall, I've not seen any, official measurement that actually includes education loan debt as a factor in cost of living. Though if I'm reading this question correctly, I agree that I think that it is something that we should be considering, because like transportation, like childcare, like food, it is often one of the largest expenses that a family has month to month. Just paying off student loans.
Absolutely, I've been there myself. All right, so we are coming up. It's 12:30 now. I don't believe I'm seeing any more questions at the moment. We might have time for one more. If somebody wants to type in one last question or comment, we could take that. And otherwise, I will say again, we encourage you to register for the other 2 webinars that are coming up. If you think that this information was helpful, then let other folks know about the webinar series. We will also be sharing the links and the presentation and how you can view the recording after the fact here today. And we haven't talked about this much publicly, but we're also hoping to lead towards some type of statewide event or something that we're moving towards in the spring of 2020 through NC Child and allied organizations, where we can talk more about family economic security and some of these issues. So with that, I want to thank everyone for being on the webinar and for your participation and good questions. And we hope to have you on the next one. Thank you.